All right, thank you. Okay, we know that carbon monoxide poisoning, most of the studies that we've seen on it, especially in long-term studies, relate to the delayed neurological syndrome, but there's not a good follow-up studies on what's the long-term mortality when it's associated with myocardial injury. And as we know as toxicologists that the two tissues that are at most at risk with CO poisoning obviously are the CNS and the myocardium. So I thought this was a great study because it was a prospective 8-year study carried on from 94 to 2002 at a major referral center where patients were referred there specifically for HBO treatment of moderate to severe poisoning. And if you look at it as we get on, so I think it's more severe than moderate poisoning in this group. But these were all adults, and they were followed after the treatments. They were followed for an average of about 7 years total, but they were followed through 2005 for long-term mortality after they've been treated for CO poisoning. So there was 230 patients enrolled, and the average were 47-year-old males, 72% were males, and most of them, about 60%, were accidental poisonings, whereas the remaining 40% were probably all intentional suicidal attempts. And there was a high illness severity in all these patients. More than 50% of them were intubated before they were transported. There was more than 80% had transient or persistent loss of consciousness. Most of those, of course, 80% had a GCS less than 15. Many of them required some pressors, and there were a fair amount that required cardiovascular intervention with cardiovascular drugs. So these were definitely severe. I would place these in the severe CO poison group, but they call it moderate to severe. So we know these aren't people that came in because they think they have a headache because the CO alarm went off on the apartment below them. These are definitely patients that were poisoned. And despite the severity of their initial injuries, there was a really fairly low in-hospital mortality rate. It was only 5%, and most of them were actually people that died from the associated injuries, fire victims, burns, etc. was what the cause of mortality. So while they had a severe CO poisoning, they had a low in-hospital mortality rate. And then assessed the cardiac risk factors. More than half were smokers. About a fifth of them had hypertension. Small percentage had diabetes. But incidence of prior cardiovascular disease in this population was uncommon, and you saw the average age was about 47%, so it's not surprising that prior cardiovascular disease was uncommon. So they assessed the elevated biomarkers or incidence of these severely CO poisoned patients. What's the incidence of in-hospital myocardial injury? And so 81 patients had elevated biomarkers. Troponin 1 greater than 0.7 or CKMB greater than 5. And then if the ones that the biomarker wasn't available, there were 4 patients that actually had diagnostic EKG changes of myocardial injury. So in total, there was 85 patients that had evidence during their hospitalization for the severe CO poisoning had evidence of myocardial injury. So the in-hospital mortality, as I told you, was no different in the patients with myocardial injuries, either elevated biomarkers or abnormal EKG. Their mortality was no difference in hospital between those with the myocardial injury and those without. But post-discharge, for an average follow-up of 7.6 years, it was pretty amazing difference. There were 42 additional deaths, and the standard mortality ratio was 3 times what was compared to the U.S. statistics for that age group. And of the people that had myocardial injury, 32 of the 85, in other words, 38% had mortality in that 7.6-year follow-up, whereas those that had no evidence during their hospitalization of any myocardial injury, their rate of death in that follow-up period was only 15%. So it was more than twice the mortality. And you can see it's pretty clear on the graph that myocardial injury, evidence of myocardial injury at the time of CO poisoning, it was a good predictor for post-discharge mortality. So the conclusions are, I think there was a pretty nice study in that it's one of the, it makes sense that people that would have had myocardial injury would be at risk of later complications and cardiovascular death. And by while the cause of death was not available on every single one of these ones, most of them were from cardiovascular causes. And they found that typical predictors like smoking or hyperlipidemia was not a predictor of ones who were going to go on and die, but hypertension and diabetes was. So we know that myocardial injury, from this study we know that myocardial injury, clinical evidence of myocardial injury in patients with moderate to severe CO poisoning is actually fairly high, and that it's a good predictor for an elevated biomarker of myocardial injury or diagnostic EKG changes is a good predictor for subsequent cardiovascular death, with more than 2 times the mortality rate of those that did not have any evidence of myocardial injury at the time of their poisoning. So the recommendation was that patients with CO poisoning, all patients with moderate to severe CO poisoning, obviously should be screened for myocardial injury, looking for elevated troponin, CKMB, diagnostic EKG changes, etc. And those that do have a positive biomarker or positive myocardial injury should be aggressively followed up post-discharge because of the increased mortality rate. And they should have extra studies done for risk stratification and prevent further mortality. So that is it.